Welcome to Nz-Osce learning sessions. Today we will go through Station 2 Physiological Assessment. Carefully read the scenario within 2 minutes. In this settings, you are a nurse in GP's clinic. You have to identify the person by his name, age, date of birth and NHID. Patient situation is she has come to the clinic for a regular checkup. Her background history revealed she was diagnosed with hypertension 1 month back and was on antihypertensive, and she has COPD and is on bronchodilators, and she is waiting to meet her GP. Our task is you have to monitor her vital signs: temperature, pulse, respiration, BP and saturation level. Your countdown begins for 8 minutes with a warning bell at 6 minutes. So as usual, you have to knock the door before entering, and you have to look for scene safety and ensure the patient privacy by closing the door. And start doing hand hygiene while simultaneously introduce yourself and explain the purpose of your visit. Hello, good morning. I am so and so, a registered nurse. How are you doing? I am here to assess your vital signs. Shall I proceed with that? Before moving further, could you please tell me your name, date of birth and NHI for verification? So she may reply. And once it's got, then thank you for sharing with that. So always, before beginning the assessment, confirm or verify the patient's ID by asking their name, date of birth and NHID. Then let's start our assessment. Start by saying, I would like to assess your temperature first. Is that okay for you? And continue like, have you had any recent ear infection or underwent any surgery, or do you have any pain in your ear? And always ask, are you using a hearing aid? Are you using a hearing aid? If it is yes, you have to again say that it's better to remove before the measurement. You have to instruct them to remove it before proceeding the assessment. Okay. Again, continue with which ear do you prefer for reading? Once done, inform the patient your temperature is so and so, and it is within the normal range. And in this station, you have to always be familiar with the tympanic thermometer, know how to attach the disposable caps, turn on the device and use it correctly. Am I clear to you? Okay, let's move on by checking the oxygen saturation. Again, you have to ask or you have to continue like this, the conversation like, now I will assess your oxygen levels. For this, I need one of your fingers. The process will take just a few seconds. Okay. Once the reading is taken, inform the patient that your oxygen level in the blood is so and so, which is in the normal limit. If the oxygen level is too low or any discrepancy you can see in this oxygen level, ask about any underlying conditions and educate the patient on breathing exercise that can help. Okay, so that's about oxygen saturation check. And next is respiration rate assessment, like respiratory rate assessment. You have to ask again, shall I proceed with checking your respiratory rate? For this, I will place your hand over your abdomen and count your breaths for 1 full minute. Okay, take 1 full minute to count respiration by counting each rise and falls as 1 breath. Once done, again you have to declare that your respiratory rate is so and so. If it is less than 12, we called as bradypnea. Then you can ask for, have you had any breakfast? Are you on any medication? Do you have any lung conditions? If it is more than 20, again you have to just initiate the therapeutic conversation like, do you have any stress? Or do you have any heart disease or any lung conditions? Okay, like that way you have to continue your conversation while taking the or while assessing the vitals. Okay. Next, pulse assessment. Again ask, shall I now proceed with checking your temperature, or let me assess your pulse rate now? Then you have to explain that I will assess your radial pulse. It's located in the wrist. I will assess for 30 seconds. And you have to verbalize that I will multiply by 2 to get the beats per minute to impress your examiner. And once it's done, you have to again mention that so your pulse rate is so and so. If it is less than 60, that we called brady, and more than 100, it's tachycardia. If any values beyond the limit, have to mention the rate is high or low, maybe due to certain conditions, or do you have any health issues. So all those things you have to just make a conversation in between. Okay, then we will assess or we will move on with taking blood pressure. Again you have to initiate the conversation like let me check your BP now, or now I will check your blood pressure. And again you have to explain the procedure. Then you have to ask for which arm do you prefer to perform this blood pressure measurement. Have you undergone any breast surgery, or done any procedures in that hand, or any fistulas present? All those things you have to ask before taking the measurement. If it is yes, move on with the other hand. If it is no, you have to explain the procedure that first I will assess like your palpatory pressure, followed by your auscultatory pressure. For that I will place the cuff 2 to 2.5 inches above your elbow region. It's better not to use that technical terms. Okay, instead of saying that, you can use I will place the cuff just above the elbow, around 2 to 2.5 inches above your elbow. As I inflate the cuff, you may feel some pressure, but it's quite normal. It will take only a few seconds. Then once measured, you have to say again your blood pressure is so and so. And it's mentioned in the background situation, like the patient is having the patient is using this hypertensive medication. So you can ask, have you taken your regular medications today? Okay. And if it is still high, you can just say that it's better to do some exercise and try to follow a healthy menu. Okay, am I clear to you? Then finally, again you have to explain in front of the patient that now I will document your vital signs in your file. Don't worry, your GP will see you soon. If you have any concerns, feel free to ask. Like that you are saying. We used to say like this, if you have any concerns you may ask, or if you feel any discomfort you may press the call bell. The same way we can say that within no time your GP will see you soon. If you have any concerns, please feel to ask. By following this structured approach, you have to ensure a thorough, professional and a patient-centered approachment or patient-centered assessment. Okay, after completing this vital signs, I told you that the next important step is documentation. As we are going through now, this ensures accuracy and continuity of our care. Okay, so don't forget that ensure all the details are clear and complete before proceeding. That means record all the vitals. And if it's mentioned pain, you have to ask for, do you have any pain or discomfort? And pain assessment findings accurately in the patient file you have to mention. And reassure the patient that I hope everything is clear. Your GP will see you soon. If they have any concerns, remind them. They can always ask for assistance. Okay, that's all about Station 2 Physiological Assessment.